to Chamber Chat. I'm Stephanie Ford. This week we are chatting with Dr. Duber, AdventHealth, and he's going to be sharing a little bit more about robotic knee surgery.
Yep.
So let's just jump right in. We're welcoming him back. You're not new to Chamber Chat, so thank you.
I appreciate it.
Just give us a brief high level about yourself again for those of you that might just be tuning in for the first time.
Well, I'm Dr. Mark Duber, so I'm an orthopedic surgeon for AdventHealth, New Smyrna Beach. I specialize in total joint replacement, including hip, knee, and shoulder replacements. I've been with AdventHealth for almost a year at this point, and we're growing our practice of knee, hip, and shoulder replacements. And today we're here to talk about exciting changes, which include a robot for knee replacement.
Very exciting. Last time you were here, we were all about the hip, right? So you can go back and check that out on our channel. And so this time we're talking about the knees. Gosh, I feel like something's always cracking and creaking with the knees. So is this a new robot, a different robot? Tell us a little bit about that.
So for New Smyrna, this is the first orthopedic robot that we've ever had at the hospital. The robot is changing knee replacement, and the reason why is you kind of look at the older side of the way things have been done. They were done in a way that was kind of measuring using guides and everything. Everything's robotic and computerized at this point. So what it does is it makes the knee replacement a better surgery, and the better that you put a knee replacement in, the longer it lasts, the less complications people have, and the easier it is to get people home the same day.
Great. So does that help with recovery time? Talk to us a little bit about that.
So it's a similar incision to the way it used to be done. It's just the process of the actual knee replacement itself. The more accurate we can do that knee replacement, the better we can make bone cuts and align the implants within the patient's body, the less pain they have because everything works better. And then I would say the overall recovery is quicker because of that.
That's great. So how is this similar or different from a traditional knee replacement?
So in the robotic knee replacement, I would break it into two parts. Okay, number one is the computer that controls the robot, and then the robotic arm itself that does a lot of the work for me or for any surgeon that uses it. When we get ready to do the cuts into the knee to put implants in, it's about the evaluation of the knee. What the computer part of the robot does, it does a full evaluation of a patient's knee. And to back that up further, old-fashioned knee replacements were done one size fits all. The way a robotic replacement goes, every patient's knee is different than another patient. So we're looking at things, not just the bone parts of it, but also the ligaments. And the computer does an evaluation of the knee, and it sets a specific algorithm for that specific patient. And if I can make that knee replacement specific to their knee, patients do exceedingly better than they did with the old-fashioned surgeries, and the revision rates and secondary surgeries are much, much less.
Wow, that's incredible. So you're guiding the robot, or you're working with the robot?
So I'm working with the robot. The robot computer will do an evaluation for me with my assistance. And then once it decides on a plan and I accept that plan, when I'm actually doing the bone cuts in the knee, I'm controlling the robot. It's not autonomous, but it's directing me in the plan that we created between the robot and I.
Wow, that's great. I didn't realize knee replacements were kind of a one-size-fits-all, and this is really a game changer to customize it, really get the best results, the quickest results, and have the best patient care, it sounds like.
Absolutely, and I would just say that, I mean, in traditional knee replacements, in general, if I just kind of ballpark a statistic, I would say 80% of knees do well. But there's always the 20% that are just the outliers, that it was just not right for them, or it was a little bit off. And I would say now we're 99.9%, everybody's getting the knee that they need for it to be functional to work well.
Wow, that's exciting. Okay, so how do you know if you need knee replacement?
So a knee replacement is for osteoarthritis. Osteoarthritis is when we've worn down the cartilage inside of our knee. And there's all different compartments in the knee, but you have your tibia, you have your femur, and you have your kneecap. Once you wear that cartilage down, people start developing pain and swelling in their knee. We usually identify that from an x-ray. Once we get to a point where we have a moderate or severe level of arthritis, then we start talking about knee replacement. But before that, we look at conservative care. Conservative care can include physical therapy, it can include injection therapy, to include steroids and the gel injections that people have heard of before. And there's different other types of conservative care that includes PRP injections. But once we've exhausted all those conservative cares, and the pain's still there and the swelling's still there, then we start talking about knee replacement, and that is an absolute fix for arthritis when we get to that point.
Wow, we've heard that A word a couple times now, the old arthritis.
Yeah.
Any preventative care that you want to share or talk about when it comes to that?
So I would say generally arthritis is caused by two major things. One is genetics. Some people are more likely to get it than other people based on activity levels. But number two is injury. If someone's been an athlete, they were playing football, they were playing soccer, they had multiple injuries, they created some damage to the cartilage, that can worsen quicker over time, leading you to knee replacement at a younger age.
Yeah.
And when it comes down to age, I mean, if we ballpark an average, I would say the average age is probably about 65. Okay. But we see a lot more knee replacements now, somewhere in the 55 range. And then we can go I've had people go as long as in their 90s, just depending on the activity level of the patient, how healthy they are. And the nice thing about current knee replacements is the implant materials are so good that we're generally getting almost 30 years of a knee replacement, so that's allowing us to do it at a younger age.
That's great. Well, it sounds like good stuff. I mean, if that's the route you got to go, this is really exciting news.
Very exciting.
So how can folks find out more about this?
So they can find out more about it by just on New Smyrna Hospital, AdventHealth. You can look up the website, and then that'll have all of our contact information. It'll actually talk about the robot. It'll talk about my practice, the types of surgeries that I do. And then they can call, get an appointment, and we start an evaluation.
Great. That sounds good. Well, thank you so much for joining us today. As always, a special thank you to Shark City Media for producing this content.